Have you ever woken up in the middle of the night feeling like something was not quite right with your body, but you could not put your finger on what it was? Have you noticed that climbing the stairs to your bedroom has become more challenging than it used to be? But you dismissed it as just getting older. What if I told you that these seemingly innocent changes might be your heart's way of crying out for help? You see, after the age of 60, your heart does not always announce its troubles with dramatic chest pains or sudden collapses like we see in the movies. Instead, it whispers its distress through subtle signs that are so easy to overlook, so easy to blame on aging, that millions of seniors miss the early warnings of serious heart disease every single day. The truth is, heart disease remains the #1 killer of Americans over 65, claiming more lives than cancer, diabetes, and accidents combined. But here is what most people do not realize. Your heart starts sending you warning signals months, sometimes even years, before a major cardiac event occurs. These signals are like gentle taps on your shoulder, trying to get your attention before they become life-threatening emergencies. Today, we're going to talk about 9 subtle signs that could be early warnings of serious heart disease. These are signs that many doctors might miss during a routine checkup, signs that you might be experiencing right now without realizing their significance. Some of these signs are so common that you might think they are just part of getting older, but they could actually be your heart's desperate attempt to tell you that something is wrong. What makes this information so crucial is that catching these early warning signs could literally save your life. When heart disease is detected early, when you can still do something about it, the outcomes are dramatically different. We are talking about the difference between living a full, active life well into your golden years versus facing serious cardiac events that could change everything in an instant. You might be thinking, I feel fine most of the time. I do not have chest pain. My doctor says my blood pressure is okay. But here is the thing about heart disease in seniors. It is incredibly sneaky. It does not always present itself the way medical textbooks describe. Your heart might be struggling, your arteries might be narrowing, your cardiac function might be declining, and you might not feel any of the classic symptoms that younger people experience. This is because as we age, our bodies change in ways that can mask the typical signs of heart problems. Our pain perception changes, our energy levels naturally shift, and we often attribute new symptoms to the inevitable process of aging rather than recognizing them as warning signs of something more serious. Over the next few minutes, I am going to walk you through 9 specific signs that could indicate your heart is in trouble. These are signs that cardiac specialists look for, signs that emergency room doctors take seriously, but signs that often go unnoticed in everyday life. Some of these might surprise you because they seem completely unrelated to your heart. Others might make you realize that symptoms you have been experiencing for months actually have a name and a cause. The goal here is not to frighten you, but to empower you with knowledge that could help you catch potential heart problems early when they are most treatable. Knowledge that could help you have more productive conversations with your healthcare provider. Knowledge that could quite literally add years to your life and life to your years. Before we dive into these 9 critical warning signs, I need to know that you are with me on this journey. If you are someone who takes your health seriously, if you want to stay informed about what your body might be trying to tell you, please hit that subscribe button and turn on notifications. This is where we share the health information that could make a real difference in your life. And I want to know where you are watching from today. Are you someone who has been experiencing some of these subtle symptoms? Are you watching because you are concerned about a loved one? Drop a comment below and let me know. Your engagement helps us understand what health topics matter most to you. If this information resonates with you, if you think it could help someone you care about, type the number 1 in the comments. If you think this is not relevant to your situation, type 0. But please stick with me through all 9 signs, because you might be surprised by what you discover about your own health. Sign number 9. Unusual fatigue that cannot be explained. Let me start with something that almost every senior experiences but rarely connects to their heart. Unusual, persistent fatigue. Now, I'm not talking about feeling tired after a busy day or needing an afternoon nap. I'm talking about a deep, overwhelming exhaustion that seems to come from nowhere and does not improve with rest. This kind of fatigue is different from normal tiredness. It is the kind of exhaustion that makes simple tasks feel monumental. You might find yourself feeling completely drained after activities that used to be easy for you. Maybe you used to enjoy grocery shopping, but now just walking through the store leaves you feeling like you need to sit down. Perhaps you used to love gardening, but now even light weeding makes you feel utterly depleted. What many people do not realize is that this type of fatigue can be one of the earliest signs that your heart is not pumping blood as effectively as it should. When your heart struggles to deliver oxygen-rich blood to your muscles and organs, your body has to work harder to accomplish the same tasks. This extra effort translates into that deep, persistent tiredness that no amount of coffee or rest seems to fix. Women, in particular, often experience this type of fatigue as an early warning sign of heart disease. While men might feel chest discomfort or pressure, women frequently report feeling unusually tired for weeks or even months before experiencing any other cardiac symptoms. This fatigue might start gradually, getting worse over time, or it might hit suddenly, making you feel like you have aged years in a matter of weeks. The key here is to pay attention to changes in your energy levels that cannot be explained by other factors. If you are getting adequate sleep, eating well, and have not had any major life changes, but you are still experiencing persistent fatigue, it might be time to have a conversation with your doctor about your heart health. Sign number 8, shortness of breath during normal activities. Here is another sign that many seniors dismiss as just part of getting older: becoming winded during activities that never used to bother you. This is not about feeling breathless after climbing several flights of stairs or after a vigorous workout. This is about feeling short of breath during normal, everyday activities. You might notice that you feel winded while making your bed, or you might find yourself breathing heavily after walking from your car to the grocery store entrance. Maybe you have to pause while getting dressed because you feel like you cannot catch your breath. These situations should not leave you gasping for air, but they might be if your heart is not functioning optimally. When your heart cannot pump blood efficiently, your body does not get the oxygen it needs during physical activity. Even light physical activity. Your lungs might be working perfectly fine, but if your heart cannot circulate that oxygen-rich blood effectively, you will feel short of breath even during minimal exertion. This symptom is particularly important to watch for because it often develops gradually. You might not notice it at first because you unconsciously start avoiding activities that make you feel breathless. You might take the elevator instead of the stairs, or you might start asking for help with tasks that you used to handle easily. While these adaptations might seem natural, they could actually be signs that your heart is struggling. Pay attention to any changes in your breathing patterns during daily activities. If you find yourself needing to rest during activities that never used to require breaks, if you feel like you cannot catch your breath during routine tasks, or if you notice that you are avoiding certain activities because they make you feel winded, these could be early warning signs that your heart needs attention. Sign number 7, swelling in your legs, ankles, or feet. Swelling in your lower extremities is one of those symptoms that many people attribute to other causes. Too much salt in their diet, hot weather, sitting too long, or simply getting older. While these factors can indeed cause swelling, persistent swelling in your legs, ankles, or feet can also be a sign that your heart is not pumping blood effectively. When your heart cannot pump blood efficiently, fluid can start to accumulate in your lower extremities due to gravity. This happens because your heart is not strong enough to pump blood back up from your legs to your heart effectively. The medical term for this is edema, and it can be one of the earliest signs of heart failure. The swelling might start subtly. You might notice that your socks leave deeper impressions on your legs than they used to, or your shoes might feel tighter by the end of the day. You might see indentations in your skin when you press on your ankles or lower legs. The swelling might be more noticeable in the evening and improve somewhat overnight, only to return the next day. What makes this symptom particularly tricky is that it can have many causes. Kidney problems, liver issues, certain medications, and other health conditions can all cause swelling in the legs and feet. However, when this swelling is related to heart problems, it is often accompanied by other subtle symptoms like fatigue or shortness of breath. If you notice persistent swelling in your legs, ankles, or feet that does not improve with elevation, if the swelling is getting worse over time, or if it is accompanied by other symptoms we are discussing today, it is important to have it evaluated by a healthcare professional. Early detection and treatment of heart-related swelling can make a significant difference in outcomes. Sign number 6, persistent cough, especially at night. Here is a symptom that might surprise you, a persistent cough that seems to have no obvious cause. Many seniors develop a chronic cough and assume it is related to allergies, a lingering cold, or perhaps acid reflux. While these are certainly possible causes, a persistent cough can also be an early sign of heart problems. When your heart is not pumping effectively, fluid can start to accumulate in your lungs. This excess fluid irritates your airways and triggers a cough reflex. The cough might be dry and hacking, or it might produce small amounts of clear or white phlegm. What makes this cough particularly suspicious is that it often gets worse when you lie down, which is why many people notice it more at night. You might find yourself propping up extra pillows to sleep more comfortably, or you might wake up coughing in the middle of the night. The cough might be more bothersome when you first lie down for bed, improving somewhat once you have been horizontal for a while. This pattern occurs because when you lie flat, gravity makes it easier for fluid to accumulate in your lungs. This type of cough is different from a cough caused by a cold or respiratory infection. It tends to be persistent, lasting for weeks or months rather than resolving within a few days. It might come and go, but it keeps returning. Unlike a cough from a cold, it is usually not accompanied by other respiratory symptoms like a runny nose, sore throat, or fever. If you have developed a persistent cough that your doctor has not been able to explain, especially if it is worse at night or when lying down, it is worth discussing whether it could be related to your heart health. This is particularly important if the cough is accompanied by other symptoms like fatigue, shortness of breath, or swelling in your legs. Sign number 5, dizziness or lightheadedness. Feeling dizzy or lightheaded occasionally is something many seniors experience, and it can have numerous causes. Changes in blood pressure, dehydration, certain medications, or simply standing up too quickly can all cause these sensations. However, frequent or persistent dizziness can also be a sign that your heart is not pumping blood effectively to your brain. When your heart cannot maintain adequate blood flow, your brain might not receive enough oxygen-rich blood, especially during position changes or physical activity. This can result in feelings of dizziness, lightheadedness, or even near-fainting episodes. You might feel unsteady on your feet, or you might feel like the room is spinning slightly. The dizziness related to heart problems might occur during activities that require your heart to work harder, such as climbing stairs or walking briskly. You might notice it more when you stand up from a sitting or lying position, as your heart struggles to adjust blood flow quickly enough to maintain adequate circulation to your brain. What makes this symptom particularly concerning is that it can increase your risk of falls. If you are feeling dizzy or unsteady, you are more likely to lose your balance and fall, which can result in serious injuries, especially as we age. Many seniors start limiting their activities because they feel unsteady, which can lead to a cycle of decreased physical activity and worsening overall health. If you are experiencing frequent dizziness or lightheadedness, especially if it is accompanied by other symptoms like fatigue, shortness of breath, or chest discomfort, it is important to discuss this with your healthcare provider. They can help determine whether your dizziness might be related to your heart health and what steps you can take to address it. Sign number 4, changes in heart rate or rhythm. Your heart rate and rhythm can provide valuable information about your cardiac health, but changes in these patterns are often subtle and easy to overlook. You might notice that your heart seems to skip beats occasionally, or you might feel like your heart is racing even when you are at rest. These changes can be early warning signs of heart problems. Heart rhythm irregularities, also called arrhythmias, become more common as we age. While some irregular heartbeats are harmless, others can indicate underlying heart disease or increase your risk of stroke or other cardiac events. The challenge is that many people experience these irregularities without any obvious symptoms, while others might dismiss them as anxiety or stress. You might notice that your heart seems to flutter or skip beats, especially during periods of physical activity or emotional stress. You might feel like your heart is pounding in your chest, even when you're resting quietly. Some people describe feeling like their heart stops for a moment and then starts again with a strong beat. Changes in your resting heart rate can also be significant. If your heart rate has become consistently faster or slower than usual, this could indicate that your heart is working harder than it should to maintain adequate circulation. A resting heart rate that is consistently above 100 beats per minute or below 60 beats per minute might warrant further evaluation. What makes these symptoms particularly important is that they can indicate problems with your heart's electrical system. These electrical problems can affect your heart's ability to pump blood effectively and can sometimes lead to more serious cardiac events if left untreated. Sign number 3, nausea or loss of appetite. Here is a symptom that many people would never connect to their heart: persistent nausea or a loss of appetite that cannot be explained by other factors. When your heart is not pumping effectively, it can affect blood flow to your digestive system, leading to feelings of nausea, stomach discomfort, or a general lack of interest in food. This symptom is particularly common in women experiencing heart problems, but it can affect anyone. You might find that foods you normally enjoy no longer appeal to you, or you might feel nauseous after eating even small amounts. Some people describe feeling full very quickly when eating, or they might experience a general sense of abdominal discomfort that they cannot quite pinpoint. The nausea related to heart problems is often different from nausea caused by stomach issues or other illnesses. It might be persistent, lasting for days or weeks rather than resolving quickly. It might be accompanied by other symptoms like fatigue or shortness of breath, and it might not respond to typical remedies for stomach upset. Loss of appetite can be particularly concerning in seniors because it can lead to unintended weight loss and nutritional deficiencies. If you are not eating well because you do not feel like eating, your body might not be getting the nutrients it needs to maintain your health and energy levels. If you have been experiencing persistent nausea or loss of appetite that your doctor has not been able to explain, especially if it is accompanied by other symptoms we have discussed, it is worth considering whether it could be related to your heart health. Sign number 2. Sleep disturbances. Sleep problems are incredibly common among seniors, and they can have many causes. However, certain types of sleep disturbances can be early warning signs of heart problems. If you find yourself waking up frequently during the night feeling short of breath, or if you need to sleep propped up on multiple pillows to breathe comfortably, these could be signs that your heart is struggling. When your heart cannot pump blood effectively, fluid can accumulate in your lungs when you lie flat. This can make it difficult to breathe comfortably while sleeping. You might wake up feeling like you cannot catch your breath, or you might find that you sleep better when your upper body is elevated. Some people develop what is called orthopnea, which is difficulty breathing when lying flat. If you have found yourself needing to sleep in a recliner or propped up on multiple pillows because you cannot breathe comfortably when lying flat, this could be a sign of heart problems. You might also experience what is called paroxysmal nocturnal dyspnea, which involves waking up suddenly during the night, feeling severely short of breath. This can be frightening and might be accompanied by coughing or a feeling of suffocation. These episodes usually improve once you sit up or stand up, but they can be a sign that your heart is not handling the fluid shifts that occur during sleep. Sleep disturbances related to heart problems can create a cycle of poor sleep, fatigue, and decreased activity levels that can worsen overall health. Poor sleep can also affect your immune system, your mood, and your ability to manage other health conditions. Sign number 1. Chest discomfort that is not typical heart attack pain. Finally, let us talk about chest discomfort that does not fit the classic description of heart attack pain. While crushing chest pain radiating down the left arm is the stereotype of a heart attack, many people, especially seniors and women, experience much more subtle chest discomfort that can be easily dismissed. This discomfort might feel like pressure, tightness, or heaviness in your chest, rather than sharp pain. It might feel like someone is sitting on your chest, or like you have a tight band around your chest. The discomfort might come and go, lasting for a few minutes at a time, rather than being constant. The discomfort might be triggered by physical activity or emotional stress, and it might improve with rest. You might feel it in your chest, but it could also radiate to your shoulders, neck, jaw, or upper back. Some people describe it as feeling like severe indigestion or heartburn that does not respond to antacids. What makes this symptom particularly tricky is that it can be mild enough that you might not think it is serious. You might experience it occasionally and then forget about it when it goes away. You might attribute it to stress, poor posture, or muscle strain. However, any chest discomfort that is new, persistent, or associated with physical activity should be evaluated by a healthcare professional. Now that we have discussed these 9 warning signs, you might be wondering what you can do to protect your heart health and address these symptoms if you are experiencing them. The good news is that there are many steps you can take to support your cardiovascular health and potentially prevent serious heart problems from developing. First and most importantly, if you are experiencing any of these symptoms, especially if you are experiencing multiple symptoms, it is crucial to discuss them with your healthcare provider. Do not wait for symptoms to become severe before seeking medical attention. Early detection and treatment of heart problems can make a tremendous difference in outcomes. When you speak with your doctor, be specific about your symptoms. Keep a journal of when you experienced symptoms, what you were doing when they occurred, and how long they lasted. This information can be invaluable in helping your healthcare provider determine what might be causing your symptoms and what tests might be needed. There are also lifestyle changes that can significantly benefit your heart health. Regular physical activity, even gentle exercise like walking, can help strengthen your heart and improve circulation. The key is to start slowly and gradually increase your activity level, especially if you have been sedentary. Always consult with your healthcare provider before starting a new exercise program. Nutrition plays a crucial role in heart health. Focus on eating a diet rich in fruits, vegetables, whole grains, and lean proteins. Limit your intake of processed foods, excessive sodium, and saturated fats. Stay hydrated by drinking plenty of water throughout the day. Managing stress is also important for heart health. Chronic stress can contribute to heart problems, so finding healthy ways to manage stress, such as meditation, gentle yoga, or spending time in nature, can be beneficial. Finally, make sure you are getting adequate quality sleep. Poor sleep can affect your heart health, so establishing good sleep habits is important. If you are having trouble sleeping due to symptoms like shortness of breath or coughing, be sure to discuss this with your healthcare provider. As we wrap up today's discussion, I want you to remember that knowledge is power. when it comes to your health. By being aware of these 9 subtle warning signs of heart disease, you are taking an important step in protecting your health and potentially catching problems early when they are most treatable. Your heart has been working faithfully for you for decades, and it deserves your attention and care. Do not dismiss symptoms as just part of getting older. Your body is incredibly wise, and when it sends you signals that something might be wrong, it is important to listen. I want to emphasize that experiencing one or more of these symptoms does not necessarily mean you have serious heart disease. Many of these symptoms can have other causes, and some can be addressed with lifestyle changes or simple treatments. However, they are important signals that should not be ignored. The goal of sharing this information is not to create fear or anxiety, but to empower you with knowledge that could literally save your life. When heart problems are caught early, there are many effective treatments available that can help you continue living a full, active life. If this information has been helpful to you, please share it with someone you care about. Heart disease affects millions of seniors, and spreading awareness about these early warning signs could help save lives. Hit that like button if you found this information valuable, and make sure to subscribe to our channel for more health information that could make a difference in your life. Remember, you are not alone in this journey. There are healthcare professionals ready to help you, and there are many resources available to support your heart health. Take care of yourself, listen to your body, and do not hesitate to seek help when you need it. Your heart health matters, and you matter. Take these warning signs seriously and take action to protect your health. Your future self will thank you for the steps you take today.